TMJ, can cause some pretty incredible quality of life issues. When you get that jaw joint starting to act up and create problems, it impacts absolutely everything that you do. It impacts your sleeping, your eating, how you feel when you're out on the town. I mean, it just can really ruin everything. And so the TMJ was a big issue. So I came to see Dr. Wais to try to figure out what was going on, because I'd already had quite a bit of work done to improve the situation with the TMJ, but we found out that really there were some issues with ligament tensions and some underlying issues that we needed to get a hold of. And Dr. Wais really understood that stuff. So rather than working on the bite per se, first we worked on the blood chemistry and got that straightened out. And that seemed to really solve the problem with the way the jaw was holding itself in alignment. And so rather than having to redo the bite with the crowns, we really focused on the blood chemistry. At the end of that, just recently then, we had to just make some very, very minor changes to the crowns that the previous doctor had done. And it has put us back in a good position again. The lesson there is it's more than just physically getting the teeth to touch together correctly. There's more stuff going on, having to do with blood chemistry and so forth. And that's something Dr. Wais really understood. Other doctors didn't really look at the whole picture from the aspect of the diet and the whole body, so to speak. I mean, they just were looking at the mechanics of the way the teeth fit. I'd had a crown put in on a post many, many years ago. And during the time that we were working with Dr. Wais, that old repair finally wore out. And so we made a decision that rather than trying to go back in and just put on a new post and crown, or take the cheap route and do a bridge, because it was so important that the bite remain absolutely stable and for long-term quality of life over many years, we decided to go ahead and do an implant on that tooth. And Dr. Wais is really, I think, really good at doing implants, so I'm very glad we did. It's very, very stable. One of the things I really enjoyed about working with Tom Wais is that, he's not just thinking about patching a hole or fixing a broken crown for today, but we're really looking at the long term, and I mean 20, 30 years of a really good quality of life, enjoying eating, enjoying being out. And so his entire approach to dentistry is really based around what's not going to happen just in the next year, but really how is this dental work going to serve you and me as the patient over the long run. And I think that's pretty unique and very special. Dr. Wais is really good about explaining all the options. For example, the situation with an implant, did I want to do a repair, did I want to do a bridge, did I want to do an implant, and laying out the costs, of course, which are very important, but also the long-term prognosis about how these things tend to last over the long run and how well they serve the patient. And yeah, so he's very good about giving you all the choices you want and make an educated decision about how you're going to proceed. I think for the quality of work that we're getting with Dr. Wais, I mean, it's really top quality work. I think his fee structure is very, very reasonable. I mean, I don't feel like I'm buying a new set of tires from my dentist's airplane every time I walk in here. I mean, I think it's a very reasonable fee structure. The process of really working on a TMJ issue, particularly mine, because I think mine is apparently a little more pronounced than some, it's a long process and it takes a lot of patience, both on the part of me, the patient, and Tom Wais, the doctor. The body responds slowly to some of these therapies, especially trying to redevelop a protein count that's appropriate. So it can take a long time. I spent 3 years with my dentist in another state before I retired and moved here. And I've been seeing Dr. Wais almost again for another 3 years to work through this slowly and carefully. But I'm very patient, so maybe I take a little longer than some. I'm willing to go through the long drill to get it right, and so is he. I would say to anybody who's having real acute problems, and chronic problems rather, with neck pain, jaw pain, headaches, to understand that there are viable alternatives to somebody going in with a scalpel and carving on things. That used to be, I guess, kind of a popular remedy, and I would absolutely never let anyone do any surgery to solve the TMJ problem. I'm totally convinced from my journey that it can be managed properly and perhaps even completely cured by improving the bite, looking at the way the body is closing the jaw and working on all the issues around that. Tom Wais has done that for me in spades.